Welcome to FitLife Med Spa's webinar, Fabulous Over 40, How to Stop Feeling Like a Hot Mess. I'm Susie Hessman, the owner here at FitLife Med Spa. Today, we're going to talk about what you can do to look great and feel great over 40. But first, let me introduce you to some of our fantastic providers. First, we have Elvira Quijas, nurse practitioner and medical director. Elvira has been a nurse for over 30 years. She is well loved by her patients for her great bedside manner. She does our hormone optimization, erectile dysfunction, vaginal rejuvenation, and many other treatments for rejuvenation of the face and body. Next, we have Heather Allen, nurse practitioner. Heather has also been a nurse for over 30 years. Heather is really an artist when it comes to aesthetic procedures. She also does our hormone optimization, erectile dysfunction, vaginal rejuvenation, PDO threads, Botox, fillers, and many other rejuvenations of the face and body. Next, we have Devin Moreno, RN BSN, our nurse injector. Devin has also been a nurse for over 30 years. She will help you feel relaxed and comfortable while she expertly performs your treatment. She does Botox, fillers, vaginal rejuvenation, erectile dysfunction, and lots of other rejuvenation for the face and body. Next, we have Kelly Combs, medical esthetician, certified laser tech. She is an expert at figuring out the best treatments in combination to give you the best results possible. And last, we have Leilani Garcia, also medical esthetician and certified laser tech. Leilani is new to the industry, but has been trained on all the latest and greatest in technology. She ensures that our patients receive excellent results. Today, you're going to hear from these experienced providers firsthand. Not only are they great providers, but they're also patients for all of our treatments. Most of us here are over 50 and have personally experienced all the problems that come with aging. I personally am 54 years old. I had a hysterectomy when I was 30, but they left my ovaries and told me I would never need hormone replacement therapy. Within a year, I was a complete mess. I didn't know what was wrong. I was crying for no reason and had 3 little girls to take care of. I tried the bioidentical creams. They helped at first, but then stopped because you can't control how much your body absorbs. Then I found out about the pellets and have been a faithful patient since. When I forget to put myself on the schedule, my husband will ask timidly if it's time for my hormones. Also, I've lost 78 pounds on our weight loss program, have had vaginal rejuvenation for my leaky bladder, and have had face and body rejuvenation treatments. I am passionate about helping patients look great and feel great here at FitLife Med Spa. All right, we are now ready to hear from our expert providers.
Hi, everyone. I'm Elvira Quijas. I'm a nurse practitioner and medical director here at FitLife Med Spa. I'm going to talk a little bit about hormones and just have you ever asked yourself, what if you could feel like this again? Okay. Feeling fabulous over 40. Feeling fabulous over 40. So let's take a head to toe look at ourselves, kind of refresh with what we can do with our body. With hormone optimization, intimate wellness, we can do some weight management, body sculpting, skin rejuvenation, and hair restoration. Okay. 6 major female hormones that we really need in order to feel fabulous over 40 is estrogen, progesterone, testosterone, cortisol, and some DHEA. Remember, these hormones are affected by our physical and emotional levels. Hormone declining is a problem for all of us. So as we get older, our estrogen declines, our progesterone declines, our testosterone declines. Some of the positive effects that we have from estrogen is it controls hot flashes. Lots of us have had those hot flashes. Maintains collagen in the skin, increases the serotonin. We really need to have body density. Estrogen helps to maintain that, increase bone strength, helps prevent those neurodegenerative conditions. How many times have we gone to the doctor's office and they're like, oh yes, your estrogen has declined. Why? Because you're older, because you're over 40. Don't let them tell you that there isn't anything you can do for that, because there is things that we can do to help that. The benefits of progesterone include enhancing your thyroid hormones. It's good for your bones. It helps good sleep. It keeps your estrogen in check. So things like that are what's good with progesterone. Some small facts about testosterone. Oh my gosh, how many of us have always thought testosterone is just for men? Well, that's not true. Women also need testosterone. Testosterone, again, starts to decline at the age of 30 to 40. Who would have thought that? Testosterone. We need testosterone for libido, orgasms. Not only men don't have the libido problem. Women have libido problem. Testosterone helps to build bones. It decreases body fat. How many of us women always want? How do we decrease our body fat? Testosterone. Okay. Helps with muscle mass. Improves mental clarity. Again, this is not only for men. Men do need this, but women need this as well. The positive effects for testosterone include breast protection, prostate protection, brain protection, improved memory. It helps with anxiety relief, increased energy, increased libido, and it reduces body fat. How many of us after the age of 40 start getting that body fat that we just can't get rid of, no matter what diet we're on, what kind of exercise we're doing? Having testosterone in our bodies helps with this. Okay. Cortisol. Cortisol is one of the body's main hormones as well. Works right along with your testosterone, works alongside your estrogen. Cortisol, lots of times we have been told you have that too. Your cortisol is not at a level. You have that body fat, that mid fat. How many women saying we have this mid fat that we can't take care of? Cortisol is one way to help with that weight loss. Cortisol and body fat, increased stress causes this. Cortisol stimulates insulin production. So insulin promotes fat storage. So if we can get that cortisol under control, then we take care of some of those problems. Okay. What is a bioidentical hormone replacement therapy? You don't know how many times people have asked me, oh no, I can't do hormones. I can't do hormones. My provider has said, my GYN has said, don't go on hormones. They cause cancer. Well, we went through that. Bioidentical hormones don't cause cancer. Right? So when we do this bioidentical replacement, it helps with mental clarity. You have a low sex drive, let me help you with that sex drive. Let me give you some hormones that's going to help that. It helps with anxiety, depression, menopause. Again, with that menopause, your testosterone's low, your estrogen's low, you got low cortisol levels. With this enhancement that we do with the therapy replacement, it helps to bring that back, make you more youthful, feel energy. It helps men with erectile dysfunction, osteoporosis. I've had a few women that have come in and talked to me and said, oh my gosh, Alvera, you don't know, 2 years ago, I had a DEXA scan done. We know what a DEXA scan is, bone density, right? They've come on and they've done our replacement therapy. DEXA scan a couple of years later have improved. Why? Because we've given them that testosterone that helps with that bone. We've given them the estrogen that has helped with that. Their fibromyalgia. We never know where that fibromyalgia is coming from, but if you can get some of these hormone levels, then you have improvement on how you feel. It's just an overwhelmness feeling of feeling better with hormone replacement. The benefits of it, I've talked about that, memory loss. So it improves your memory loss. It helps with those hot flashes. It helps with those night sweats. It helps with those sleep issues. Lots of us, me included, have had a point where we've lost interest in sex, because those hormones are low. Get these replacements, and those hormones will help you to have more interest in the sex. Your partner will thank you for doing this. It helps with weight loss. You've got that weight gain. We got the benefits. We give you the testosterone, we give you the estrogen. It helps with that weight loss. It at least gives you the energy that you want to get out there and do something about the weight loss. Get going into the exercises. The hot flashes. I've had so many women come. I've had hot flashes, Elvira. Help me with this. Hormone replacement, come in, month later, 2 months later, no more hot flashes, sleeping like a baby. And they're also making their partner happy with doing this. Well, that's what I have to say about hormone replacement, feeling fabulous over 40. Let's see what Heather has to say on our next section. So here's Heather.
Hi there. My name is Heather Allen. I'm a nurse practitioner here at FitLife Med Spa. I'm going to talk to you a little bit about genitourinary syndrome of menopause, or other people know it as vaginal atrophy. So we're going to go ahead and look at these next slides here. So with menopause, a lot of women start to experience things like vaginal dryness, some irritation of their skin, pH changes. So they start to notice that they have a little bit of more yeast infections, things like that. And so what happens is the lining gets thinner and thinner as we start to lose our estrogen. And because of that, it becomes a little bit easier to irritate, and is more susceptible to trauma, just from friction, from underwear, from sexual intercourse, a number of things. So this is a primary complaint that people often come in with once they start with their menopausal symptoms. So you may experience some lower urinary tract symptoms, such as painful urination, some urgency, frequency, things like stress incontinence, and so on. So understanding the background of what genitourinary syndrome of menopause is linked to the decline of estrogen levels. There is a reduction of blood flow in those tissues, and so that results to becomes vaginal dryness, the irritation, as we had spoken about earlier. The epithelium becomes a little bit more friable. You may have some bleeding with intercourse now, or just irritation from wiping after urinating. Also, the pH levels start to change, and it makes it more opportunistic for yeast to overgrow, where your body just isn't, not protecting itself quite as well. And so the environment is perfect for excess yeast. A lot of people will start to complain about, now I get them when I never did before. And again, it's because of the vaginal change in your pH. The prevalence is about approximately half of people in the US of women that are menopausal that start to have these symptoms, and it can negatively impact day-to-day life, their sexual relationships. Just overall, we start to think about our vaginal health more and more as we get older, and becomes more problematic. Another thing with menopause is it's not only just those vasomotor symptoms where you start to have the hot flashes. We never really talk about our vaginal health as much, and that is a huge consideration. Current treatment options include replacing the estrogen. Either you can do oral medications, you can do topicals, you can do pellet therapy. Some people just treat the moisture with lubricants. There are certain treatments with lasers or radio frequency that we can use, such as the V-Tone, the Forma V, Morpheus V, and the Aviva. Those are all options that we have available here at FitLife Med Spa. So the V-Tone that we have available is an FDA cleared device that provides electrical stimulation to work on those pelvic floor muscles that have become weak over time. And its primary function is to help with that stress urinary incontinence. Also urge incontinence, any of those things that we start to develop as we have more of a vaginal atrophy and the musculature becomes very weak. So this is basically like giving yourself 20,000 Kegels in about 30 minutes, and it's pain-free. You do feel it. Your abdominal muscles might be a little bit sore afterwards, but it's definitely it's something worthwhile, and you feel it very almost immediately. So. The next one is the FormaV. This one uses radio frequency by stimulating the tissues with heat. We try to maximize that heat to stimulate the collagen and to increase blood supply. And over time, that actually can cause some tightening of the vaginal canal. If you have some laxity there, it'll increase sensation because of blood vessel supply and stimulating those nerve fibers. And again, that's a pain-free procedure. We usually do about 3 of those 1 month apart. There's no downtime and there's no restrictions after the treatment. It also stimulates the blood flow to the external structures as well. So you get kind of a lift. So most of us don't think about, oh, what does my vagina look like? But it actually improves the texture and the quality of those tissues. And they become a little bit more lifted and healthier looking. The color actually will change too as there's better blood flow. Then we have the Morpheus 8V. Some of you may already know about the Morpheus 8 and the benefits that it does for the external skin structures, but as far as vaginal rejuvenation, it also will help stimulate collagen and elastin. There is little to no downtime. I would say that you can have some vaginal irritation after the treatment because you are taking needles that kind of puncture the inside of those tissues. And so you can have a little bit of bleeding and a little soreness afterwards. It's a fairly short treatment. You have topical numbing, and then it takes less than 30 minutes, I would say. It also is going to help remodel those tissues, tighten that vaginal canal. It's going to improve moisture and sensitivity, and just kind of give you that overall benefit of feeling a little tighter again, like you did before menopause. And then finally, we have the Aviva. The Aviva is probably our most invasive procedure, but even still, it is not all that invasive. It is non-surgical. However, it does require more of a tumescent anesthesia to deal with pain. There's also more trauma to the tissues from the procedure. We are taking in a probe and melting down the fat, especially along the fat pad and the labia, majora, the minora, the clitoral hood. So it's kind of stimulating that collagen response and lifting those tissues from the atrophy. Some people are very concerned about their external appearance, and it definitely does that lifting. It's a one-time procedure. There is some pain involved, I have to say. It's basically like having liposuction in that area. So you will have some bruising and some swelling, and there is a bit of downtime and some sexual relations restrictions because you don't want to damage any of those tissues while you're healing. But outside of that, the before and afters are pretty remarkable and definitely worth doing, especially if you want to enhance the external areas if they've become lax over time. And I think that's it for my end. I'd like to introduce Kelly. She's going to be taking it from here. Thank you, Kelly.
Hi, I'm Kelly. I'm the esthetician laser tech here at FitLife Med Spa, and welcome to Fabulous After 40. Changes in your skin, start to occur during menopause. Your body stops making as much collagen, you lose some fat under your skin, and your elasticity drops. That combined with dryness can cause hormonal changes that can cause some sagging around the neck, jawlines, cheeks, as well as fine lines and wrinkles. Here at FitLife Med Spa, we have 2 devices that are great for helping this situation, if that's what you want to call it, or hormones. We have the Morpheus 8, which is a radiofrequency microneedling that is wonderful for stimulating the collagen and elastin underneath the skin, helping to plump, tighten, and firm the sagging and tightness of the skin. It is a non-invasive The Morpheus 8 is a non-invasive facial treatment that uses radiofrequency technology and microneedling to really help stimulate the collagen and production and tighten the skin. It can be used, again, to help the appearance of fine lines and wrinkles, as well as the sagging skin. It has minimal downtime and is a great option for those who have busy schedules. This treatment is also really good for body parts. You can use it on the legs, the arms, as well as the abdomen. Another treatment that we offer here at FitLife Med Spa is the iPixel and the Clear Lift. The iPixel is a ablative fractional treatment that does resurfacing to the skin, which will help with pigmentation, acne scarring, and overall just resurfaces the skin, giving you that healthy glow. This is one of our more invasive treatments for laser treatments, but the results are amazing. We also have the Clear Lift. Clear Lift is really a good treatment. It's non-ablative. It's kind of a glow and go. It does help with the appearance of sun-damaged skin, smooths fine lines and wrinkles, shrinks the appearance of pores, and reduces acne scarring. This is a great lunchtime treatment for those who have busy schedules. On to Devin.
Hi, I'm Devin Moreno. I am an RN injector here at FitLife Med Spa. I have been a nurse for 20 plus years, and I enjoy helping people meet their fitness and wellness goals. During menopause transition, many women notice a weight gain, usually between 5 and 10 pounds. It also accumulates body fat in the midsection. It decreases your lean body mass. It causes sleep deprivation, and it can cause hormonal imbalances that can cause hot flashes. Here at FitLife Med Spa, we have many solutions for your weight gain during menopause. We have semaglutide, also known as Ozempic. We have tirzepatide, also known as Mounjaro. We have skinny shots, HCG, peptides, and many nutritional programs. At FitLife Med Spa, we have all been very successful with the semaglutide program. I myself lost 65 pounds, and many of other staff members have lost between 30 and 70 pounds. It is a wonderful solution to help you maintain your weight during this time. Now passing it on to Leilani to talk about your skincare needs during menopause.
Hi there, my name is Leilani. I'm one of the medical estheticians here at FitLife. I'm just going to be talking about the Evolve X Transform treatment that we have, as well as the TED hair restoration treatment that we offer here. So Evolve X, what is it? It is radiofrequency, energy, and EMS. The radiofrequency is basically heating with skin tightening, and then the EMS is the muscle contractions, and that's going to tone and just basically tone the muscle. This is no downtime. It's completely pain-free, very comfortable treatment, and patients will experience just like a heating sensation, and then also a little bit of pressure in the area due to the EMS, but it is completely comfortable. Okay, So TED, what does TED stand for? TED stands for transepidermal delivery, which basically means the delivery through the epidermis. And in this case, we are delivering the TED hair care formula through the epidermis of our scalp. So TED uses ultrasound technology and low frequency sound waves, and it's basically pushing that that serum that has active ingredients and growth factors into the hair follicles and into the hair channels. TED is non-invasive. It is non-traumatic. It has no downtime. It's very quick and easy and pain-free. Many patients actually fall asleep during the treatment. It is that comfortable, and they report that it just feels like a scalp massage. As far as results, patients can see results in as little as 2 weeks as far as less shedding, and the bulk of the results are going to be seen more so long term after the third treatment and then so forth. So really awesome treatment for hair loss. Here's a little before and after. You can see this is the baseline, and this is only post one treatment. So that's just phenomenal results right there. And the second one is post one treatment as well. Now I'll give it back to Susie.
Will you continue on your old path, or are you ready for a new path? Is it finally time for you to take care of you? Thank you for spending time with us today on this webinar. The next step is to give us a call or text, email, and then pick a time that works best for you so you can meet with our team and start feeling like yourself again. You can also follow us on social media. You can find us at FitLife Med Spa on both Facebook and Instagram. And our website is FitLifeMedSpa.com. Thank you again. I'm Susie Hessman, FitLife Med Spa. Thank you.